There's still a good bit of folks filtering in, so I'm going to give it just one more minute. All right, I think I'm going to go ahead and kick us off and get us started. Good morning, everyone. For those of you that I have not had the opportunity to meet, my name is Bonnie Silva, and it is my honor to serve as the Director of the Office of Community Living here at Healthcare Policy and Financing. I am deeply thankful that you have chosen to take an hour out of what I know are very busy days to participate in our provider webinar. To provide an update on our current challenges facing the long-term services and supports community. Today, we have prepared a presentation to provide an overview of the compounding issues that are impacting the LTSS community, specifically around eligibility and provider payments. And we hope to provide an overview of the solutions that we have come up with and implemented and things that we are preparing to implement. We have provided a series of communications over the last several weeks, but also recognize that a webinar would also be helpful. So here we are today. I would also like to thank those of you that submitted questions in advance of this webinar today. As we are best able, we have incorporated answers to those questions throughout the slides and in the speaker's notes for their presentations. We have quite a bit of information to cover today in a really large group of participants. So we welcome questions, which can be entered into the Q&A box. We will do our best to respond to those. But if we're not able to get to a question, please know that we will be taking those questions and using them to inform our future communications. It's likely that we will not be able to get to like a live Q&A portion where we're answering questions live, just because of the sheer volume of information we have to share today. But again, we really thank you for your feedback, for your questions. Know that we appreciate them. They help us to be as responsive to you as possible. If we can go to the next slide, please. So today's agenda is I am going to spend a bit of time just providing background, or what you often hear me refer to as a beginning sentence, just to make sure that we all have the same foundational information. I will also provide an overview of the impact that the issues that we're facing have had on members and on providers. I will then hand it off to my colleagues to provide an overview of our LTSS stabilization plan and our other strategies to address the challenges that we're facing. If we can go to the next slide, please. I want to begin by making it clear that across the department, so this is not just an Office of Community Living priority. Across the department, our number one priority is ensuring that we have coverage, ongoing coverage for members who receive long-term services and supports, while also mitigating payment delays for the providers that serve them. Please know that this goal is driving our strategies that our teams have been urgently implementing over the past several months. And that is at the forefront of really everything we're doing. And we, again, deeply appreciate your patience and your feedback as we're working through these strategies to make sure that we get it right. If we can go to the next slide, please. So as we begin today, I think it's helpful to lay out these challenges in a way that can help frame our conversation. First up, we know that members are experiencing or have experienced inappropriate terminations during their renewal process. And there is a variety of reasons for that. It could be because their functional or financial eligibility wasn't processed timely because of capacity issues at the local level, or it could be that the level of care for them was missing because of an IT issue. Because of this and other system issues, we know that sometimes there wasn't a prior authorization or PAR in the system, which resulted in providers not being able to get paid for services that were rendered. We also know that our new care and case management system has some known issues and defects that are impacting both the eligibility processing for people who receive long-term services and supports, and also adding extra work for our case management agencies, because it requires some additional workarounds for them, impacting really their capacity at a local level. Case management agencies and counties, when we're looking at them collectively, due to the public health emergency unwind and the resulting challenges that we're going to talk about today, really have had an unprecedented workload. And we have had to work closely with them to figure out how we could increase their capacity to serve the long-term services and supports community. And finally, as issues are being experienced by providers, we have had really a massive influx in escalations at the state level and appeals, and we want to make sure we have capacity to appropriately respond in a timely way to those escalations and those appeals, to make sure that members are being responded to and heard, and that their issues are resolved as quickly as possible. So next up, I'm going to provide some background on how we got here, the impacts to members and providers, our short and midterm solutions that we're actively working towards. So if we can go to the next slide, please. All right, so this slide helps us really frame Colorado's case management redesign. And that's a umbrella term that you hear us use when we're actually talking about several initiatives related to case management that date back really a decade now. In 2014, there was the Community Living Advisory Group that was comprised of certainly people who receive services, their families, providers, case management agencies, state agencies, that came together and said, how do we want to redesign and transform Colorado's long-term services and support systems? And part of their recommendations were to streamline and simplify how Coloradans access long-term services and supports. Sort of in tandem with that, the federal government required us to rethink how case management was provided, specifically requiring that any conflict of interest was removed. So a case management agency could not also be a service provider agency. So with these two massive directives, we set forth on what is now Colorado's case management redesign journey, if you will, with the goals to improve quality, improve accountability, and simplify access for Coloradans. The left side of this graphic shows the goals and outcomes of transitioning from single entry points and community center boards to one case management agency serving all members in their communities that need long-term services and supports. The final agencies that will transition to this singular model will be complete July 1st of 2024 of this year. So we're in phase 3 of completing that process. The goal of this is the burden of really navigating the system, if you will, of finding the right program to fit somebody's needs and preferences will be taken off the shoulders of the members and their families, and really put on that agency to figure out, how do we connect people with all the programs for which they might be eligible. The right side of the graphic shows the IT efforts to support the efficiencies and to streamline processes for members. We launched the new care and case management system. We are going to be implementing a new assessment and support plan to be more comprehensive and objective in the determination of member goals and preferences and needs, and replace many of the other assessments that are in the system. And we are also going to have what's called a person-centered budget algorithm, which will create, an individualized budget. Will give people, I think, flexibility and autonomy in how they spend the money related to their services. This will also, make sure that we have more that funding is more equitable and needs-based in terms of how it's distributed. If we can go to the next slide, please. So we have all of this work happening around case management redesign. And then at the same time, we had, during the public health emergency, the federal government declared during the COVID-19 pandemic, the federal government declared a public health emergency. And so what that meant for state Medicaid agencies is that we had to maintain eligibility for every single Medicaid member during that public health emergency. So for Colorado, that meant our membership increased by almost 500,000 people. So we went from approximately 1.2 million members to just over 1.75 million members, as we saw, our neighbors and friends lose their jobs and their corresponding healthcare coverage. And so last year, the federal government declared the end of the public health emergency. And so that meant, for the first time in several years, that redetermination of eligibility had to happen for everyone. So between May and April, everyone had their redetermination happening. I think further compounding the workload for the county workers in particular. So this is what it's referred to as the public health emergency, or PHE Unwind, if you will. If we can go to the next slide, please. So let's just take a second and talk about these converging impacts. So, any IT system launch, like the new care and case management system, is always going to have challenges. But those challenges have been, I think, extraordinarily compounded for the long-term care community because of the convergence of these other significant initiatives. So with the care and case management system implementation, we also did a streamlined eligibility. And of course, the goal of that streamlined eligibility was to actually, ironically, mitigate terminations from services. So right now, someone might enroll into a singular waiver, such as the EBD waiver, the elderly, blind, and disabled waiver, or the developmental disability waiver. This created just a singular code for somebody to enroll into home and community-based services. We had a unintended consequence of that we had to go in and fix to stop people from being terminated, on top of the CCM issues. The team will talk about sort of the work that's underway around that in just a minute, so I won't dive too deep here. Again, we had the case management redesign, where we are transitioning many thousands of members from one agency to another, and we had local agency policies and IT systems in juxtaposition to our policies and IT systems that created some further impacts for some members. We had some great lessons learned, and so now that we're in phase 3, we've been able to mitigate nearly most of them. But the first phase, which was the Denver metro area, was certainly a challenge, I know, for many members. And then, of course, there was the public health emergency unwind, and the impact and the backlog at the county level, and what that meant for timely access to redeterminations for people, again, needing long-term services and supports. And you might be asking, why, state of Colorado, would you do these things at the same time? And I think what I would tell you is that really because we had no choice, because obviously we would not have done these things at the same time if we had the choice. The care and case management system implementation had been delayed quite a few times to make sure that the launch was more ready for the system. And the conflict-free case management, we are really backed up into a federal timeline for full compliance that we must come into, which is the July 1st timeline. And the public health emergency, obviously, as a nation, we had no idea when that would end. So, while these are some pretty extraordinary challenges, I think it's important for me to highlight that they're short-term challenges, and we have solutions identified, underway, and we can see the light at the end of the tunnel. And we have confidence that in the coming months, the IT innovations and the case management policy redesign and modernizations will create a better system for the people that we serve, the providers, and the case management agencies. And then the impact of all three of these things occurring at once will be mitigated, and we will achieve sort of that vision of a better tomorrow, I think, that was set forth for us back in 2014, if you will. If we can go to the next slide, please. I want to just highlight the impact to members that we can see. We know that members' eligibility has not been processed timely. We know that for members to be eligible for long-term services and supports, and this is why we are seeing a disproportionate impact for people receiving long-term services and supports, is that eligibility is complicated. We have to have a level of care determination, and that happens from the case management agency, previously the single entry point of the community center board. You have to have the financial eligibility determination from our local county, and then you also have to have a disability determination from ARG or Social Security, and all three of those things are required to be eligible for long-term services and supports. And of course, the issues that we'll talk about today and solutions have impacted all three prongs of those eligibilities. And so because of that, it has slowed down members' access to receiving eligibility determinations in a timely way, or of course, being inappropriately terminated. If we can go to the next slide, please. We know that for providers, claims have been denied or suspended. In order for a claim to be paid, right, our systems have certain requirements in place. Of course, the first is that the person that they served must be eligible and not terminated, and that there needs to be a member's record on file. So they have to have that level of care in place. They have to have a benefit plan, which means are they enrolled in a waiver program, an HCBS waiver program, or a nursing facility? And they also have to have a prior authorization or PAR for HCBS. And of course, if the member was inappropriately terminated or is missing any one of those things, that claim would be denied. So I think what you'll hear today is we've had several strategies in place to mitigate the impacts, certainly for members and for providers. And with that, I will transition it to my colleague, Chris Underwood, who will kick off the conversation about what we have done. Chris?
Yeah, thank you. Thank you, everyone. My name is Chris Underwood. I'm our Chief Administrative Officer, and I've been helping out on our LTSS stabilization plan with our eligibility and claims payment systems. So the first slide we have here is discussing our provisional provider payments. We made these grants of these kind of loans and payments out to providers when we were having payment difficulties. The final payment was made out on March 25th. And at this time, we aren't planning any additional short-term payments because we've lifted the PAR edits that are on those HCBS services, which we're going to discuss here shortly. And that allows providers to get paid without having that PAR in place. Every provider who got one of these payments has a repayment plan in place, and we will be working with them to help get those payments repaid and help get their other claims that are outstanding claims paid. And that's what we kind of want to jump into next. So our next slide is kind of talking about our overview of our system solutions. And we're going to go a little bit into each one of these in the next few slides. Our first is our member eligibility solutions. What we're doing is preventing members from being terminated when there is a missing level of care. And then we are helping our members get reinstated when they get terminated for LTSS. Until we get the solutions in the system stable, we are providing for our members to get reinstated after they get terminated. And we started this in February. Part of that solution we're going to talk about is extending that level of care certification for 12 months in our eligibility system to help with eligibility determinations. We're asking our counties to pause terminations when the disability determination is not available. And then we are going to fill in some gaps in the LTSS eligibility span, such as if someone was on LTSS back in July, and then they came back in October. For those 2 months, we are filling in those gaps and we're manually going in there to resolve those issues. And then I'm going to talk about some of the provider payment solutions, about what we're doing to provide a PAR or put in kind of a temporary PAR, if you will, into place so providers can see what services are authorized and be able to bill against that. We're working to reinstate those waiver benefit plans or the waiver type for the member in the claim payment system. And then we are constantly reprocessing claims to catch claims that have been denied or suspended in our system. But first, let's talk about our level of care certifications with Marivel. And so if we want to move to the next slide, we will transition over to Marivel, who leads our eligibility division.
Sure. Good morning, everyone. And of course, my camera is doing something funky. Appreciate your time today. Oh, there I am. So as Chris mentioned, we have level of care certification. So what we did in the eligibility system is understanding that level of care assessments are still being worked through. We implemented mid-April a change so that when there's a level of care that is coming up due, we're automatically providing a 12-month extension to that level of care as sort of a grace period to allow for that assessment to be done with the case management agencies. This has been done behind the scenes, so there's no impact for eligibility workers. There's no negative impact for other areas. It's a positive impact for members so that we don't have any members that get terminated for missing a level of care. What's critical is that this does not mean that members no longer need to meet level of care criteria. That's still necessary. It's just a 12-month extension that we provided. And we're doing this while we encourage for all the work that's being done to get the assessments done. So as the systems continue to do their work, as CMAs update the level of cares in the CCM tool, that will then be updated into the CBMS record. And then that will then appropriately make the eligibility determinations at that point. So that's one of the things that we've done. The next thing on the next slide that we want to address is we've heard quite a bit, and so we do want to acknowledge disability determinations. So disability determinations are done by our vendor Arbor, known as Action Review Group. So we understand that there's been disability determination delays, and we've definitely been partnering. We have a work group to kind of dive in there. So just for clarification, for cases that are already on a disability program, eligibility workers are instructed to keep the cases open and active while we wait for the completed disability determination. What we've identified through just working closely with our vendor and our and all the feedback is that when the disability determination vendor goes to request medical records are needed so that we can make the appropriate disability determination. However, we identified that some hospitals or some medical record keepers require payment for these records, and there was delays in how the setup was done between requesting payment and then making the payment, and it became a little bit challenging that we had to work through. So thanks to a lot of effort from leadership and others, we were able to overcome that. We've now established streamlining that process, setting up expedited processes to be able to get the payments in there. And so now we're working through the backlog of disability determinations to be done. And we now have direct contact with major hospitals, which will then also help that process. Because of the PHE Unwind and all the work, workload for this vendor has significantly increased. It's 5 times the normal operating volume. And between the renewals that need disability determinations and new applications are coming in. So definitely have seen an increase there. However, we work with our vendor to hire additional staff so that they can work through all these medical records and help get these determinations through. And at this point, we have very close monitoring. So we have very frequently, I think if at least once a week, if not more, monitoring workload, connecting with the vendor, working through a backlog reduction plan for all these disability determinations. So we've definitely seen some progress already. So this should continue moving forward as time goes on. With that, I will transfer over back to you, Chris. Thank you.
Yeah, so what we want to touch on now, since this is our provider webinar, is that what do you see as a provider? And what you see in the provider portal when you check eligibility is things have changed. So providers can now see when a member has the HCBS aid code for the HCBS services in the provider portal. What when we transition to our new system, we now have a general universal aid code for HCBS services, and that's the MH aid code that we have. This can, what providers may not be seeing is the actual waiver that the individual's in. And those waivers are missing. We are going in and trying to backfill and create and put those waivers back in place. So right now you may see the general universal aid code for the benefits in the provider portal. This should let you know that somebody is on HCBS. You may not know the exact waiver they're on HCBS if that code has not come over to us from our new care and case management system. So with that, we wanted to provide our eligibility verification quick guide so people can go in there and understand those new codes. You will see different kind of benefit packages depending on the waiver if that's been assigned to the member. And we're going to go through here in a little bit about how we're fixing some of those benefit plans, but we wanted to make sure that providers understood that when they go into the provider portal, that you should be looking for this MH benefit code that will show you that they're eligible for the Medicaid state plan. If you're not seeing any of these benefit codes, if you're trying to bill for a member and you can't see any of this, then that member does not have the HCBS benefit code assigned to it, and your claims will not get paid. We need to then escalate that case and get that code assigned, get that case worked to make sure that this comes through our systems. And that could be an escalation through our escalation process that we're going to show you here at the little later on in the webinar. And that could be either through a county issue is having problems processing the eligibility, or it could be having an issue with the case management agency not getting to the level of care and assigning that aid code for us so we know which waiver they're on. So for the next slide, you can see some of the work that we're doing to try and mitigate this. So we are code through the claims payment system. So we're bypassing our care and case management tool and our case management agencies, and we are creating that benefit, that waiver assignment based on prior authorization, so the prior PAR that someone had or the most current PAR. So if that PAR is in the system, we're going to reassign that benefit. If not, we are going back and looking for those benefit plans that the member will be us on and putting those into our systems. Since this time, since we started this process in March, we have been able to recreate or reassign people close to 7,400 benefit plans. And once we assign those benefit plans and reprocess the, we were able to pay out $1.6 million to providers. So this is our ability to now get out the door to providers without having all the fundamentals in place that we normally do, such as the benefit plan coming from the long-term care system and from the PAR being established by the case management agency. So we're putting those workarounds in place so providers should be seeing an increase in money that's coming now out through the department. We will continue to do this process. We're doing this on a weekly basis to reassign these waiver benefit plans and then reprocess claims. Let's go to the next slide. And this slide also addresses how we're doing that with PARs. So we have been working to escalate how we get PARs in the system as quickly as possible. Right now, we have a temporary workaround that claims will pay even if a PAR is not in place. So if you have been traditionally providing a service to a member, we ask that you continue to provide that service even if the PAR is not on record. When you bill, you will get paid for those services, assuming the individual is in the eligibility system and they've been approved, and that you can see that they have an active HCBS aid code in the system, but no PAR exists. Go ahead and bill for that. You should be seeing those payments come through. We sent out a notice on April 2nd stating this information. So if you don't have that information, please click on it here. It's now in the Q&A information. This will allow providers to go all the way back from July 1 of 2023 to be able to bill for those services and catch up on your payments. And we are working on a longer term solution that will help us generate those PARs more quickly and get them faster in the system, so you can get a little bit more accurate information on exactly the services that are currently authorized. Then if we want to move to the next slide. So as we reprocess these claims, as I've talked about, we've reprocessed and paid out $11.6 million in additional payments to providers. We want to also state that we now have 40% of those individuals now have an active PAR in the system. This number is growing every week, and our goal will be eventually to get to 100% of those active PARs in the system. So as we're reprocessing these claims, we are asking providers to resubmit any suspended or denied claims to keep them active and get them paid on a monthly basis. We are doing our best to reprocess those claims, but if you still don't have a claim that's been paid, we ask you to continue to submit those claims. That way, as our activities and as we've talked about, filling in the eligibility gaps, creating the benefit plans, creating the PARs, as those are reoccurring every week, more and more claims will get paid. With that, I'm going to hand it off to our next topic, which is other strategies to address LTSS challenges. And Maribel is going to help us talk a little bit about some of our member terminations. So if you want to move to the next slide. Thank you, Maribel.
You're welcome. Happy to kick off the other strategies, and then I'll hand off as well to my colleagues. So the first thing that we want to talk about is member terminations. And so strategies that we've done within the eligibility system are CBMS to address these terminations. So as we identified the terminations that were occurring, our first goal was to get members that had been terminated reinstated. So reactivate their eligibility status. So we began an interim solution in February. And based on the reinstatements, we reopened their eligibility, their financial eligibility. For those that had a termination date of February 29th that had been notified of that. So we had approximately 6,656 members, all in February. As we were working through that, the way we notice individuals, we try to give a really advanced notice that terminations are occurring. So we were focused on the February 29th, and then there was terminations that occurred from March 31st. So then we came back and then also reinstated and reopened all the members that had a March 31st termination date, and we reopened those as well. And those were about approximately 6,125. The first month, February, included all of our long-term care members. And then the second month included long-term care, and we added our Working Adults with Disabilities buy-in program and our Children with Buy-in with Disabilities buy-in program as well. So that the second month included those numbers, and now they're included going forward. So that was our very first step. So then our next step that we were able to implement is this penned feature that we have listed here in CBMS. Essentially what we did is with all our remaining active members, every single long-term care and buy-in member, a little bit of tech speak, we put in the eligibility system append, which basically keeps them active. This is really critically important and beneficial for members because this mitigates a termination notice from being triggered, which then mitigates disruption of care and all the downstream impacts that happen with these members. This option that we leverage is something that already existed in our system. As such, it allows eligibility workers to still process the case and do the data entry, and as we're talking about catching up on backlogs. As such, there is a potential that a few members may still end up receiving a termination notice because maybe the pen doesn't go back. We have put system edits in place to be able to catch those. And so we anticipate there will still be reinstatements that occur, but it should be very significantly lower than the first 2 months that we did going forward. So this is really important to us. We've already started the April 30th terminations, and it's significantly less than 1,000 members that are being reinstated, which means this pen is already working to keep members open and mitigate those disruptions in coverage. Next slide, please. So other things that we're working through as we continue through prospective strategies, Chris already mentioned this a little bit, but we're working on filling in the gap for eligibility spans. We've identified all members that were in long-term care and then had a gap, whether it be a few days or whether it be a few months, whether it be they lost coverage completely or they went to a lower benefit category. We've identified all those spans going back to when we started PHE Unwind. And so we're working a plan to try and fill those gaps as quickly as possible. In addition to that, we're also working on a plan to identify members that were terminated previous to March 1st and are still inactive. So there's work that's going on there to then also look at not only take care forward, but also look at retroactively. As we continue to do this, we really encourage members and or their authorized rep to continue to update their address on file so renewal information is received. These renewals they're not new with the end of the PHE. There was some compliance changes that we made with these renewals, which is why there is quite a bit of impact. But those compliance changes are going to be required every year going forward. So the renewals are not going to end at the end of this month. They're going to continue on their yearly cycle as they normally do. So we just encourage just to have an updated address, and making sure that so we can get these renewals to members. We've also then, as part of the process that we've been working on, is we continue to have a close partnership with our counties and our eligibility sites to identify when any hiccups that we may have on the way renewals are received and making sure that they get processed timely. We have even recently sent out a training that we're actually going to make mandatory so that when members submit renewals through PEAK, for example, that we make sure that eligibility workers are able to access that information so that we can get these processed timely. So quite a bit of work going on the eligibility side as well. And now I will hand it over to my colleague, Amanda, to talk a little bit more about the case management agency side perspective. Amanda?
Good morning, everyone. Thank you for joining us. I appreciate your time. I'm Amanda Lofgren. I'm the Case Management and Quality Performance Division Director. And so as you heard Bonnie, talk about early on in the slide around, we have implemented case management redesign and making those transitions to the new case management structure and requirements to provide increased quality oversight, as well as implementing our new care and case management system. We have seen and heard and have regular contact with our case management agencies, and the day-to-day workload for case managers is really challenging right now. And so working really closely to understand where those pain points are in their day-to-day workloads, but also where the system is impacting that or other policy changes. So that for those case management agencies that have backlogs in their activities or other requirements, we can work closely with them to create a backlog reduction plan and monitor that closely with them so that we're seeing where they're making improvements and progress or where the system changes that are happening, may not be impacting them right away, but over time we're seeing that they're able to catch up with some of the multiple strategies that we're implementing. We have provided with ARPA funding several payments for retention for case managers themselves as well as change management and capacity building with executive coaches for each of the case management agencies as they navigate through the changes with the system, but also the programmatic changes. We also have received or will be receiving additional funding for case management agencies specific to stabilization efforts, so that they have the capacity and resources internally to support the increased workloads and challenges they're currently experiencing until we stabilize the systems. We also are working really closely to increase the communication and support around all of the various activities and changes and strategies that have been implemented, making sure that they have the information that they need both for internal changes, but also supporting members and providers through navigating the processes. So we have created a new case management agency toolkit and have established some additional meetings to really support their agencies and their leadership teams more regularly and consistently. We also have conducted a site visit with our IT vendor and our health information office for the 3 agencies that are primarily experiencing backlogs at this time to really understand how the care and case management system is impacting their day-to-day workloads, where there's additional pain points, and how we can prioritize resolving the known issues and the workarounds that we have as part of our stabilization efforts. And so we will continue to work with those 3 agencies, both from a programmatic and an IT infrastructure. But all of our case management agencies across the state are feeling the challenges related to the new IT system. And we have, as I'll talk in the next slide, a little bit more detail about the strategies we have there. We also, our county partners and our county team are working closely with their counties to make sure that they have the resources and training and support they need for the work that they do to address the backlogs. There are 5 counties that are working with the county team to finalize their backlog reduction plans and really address their internal system improvements. We also, as part of that work, the department requires all counties to provide their ADA accommodations publicly. And so we have, at the department, approved all of their plans. And so those should be posted publicly. However, if you have not found those or identified them, you can certainly request those from the counties because they are available. If we go to the next slide, if we talk a little bit more about the care and case management system, as we implement and we are stabilizing, making sure that the case management agencies have a solid line of sight around what changes are happening, when they're happening, when will the defects or the known issues be resolved, but also the policy changes and the program changes. And so having a more formal short-term and long-term communication strategy to assist them as they navigate through the day-to-day workloads, but also how do we improve the training materials and documents so that they have at their fingertips, if there is a workaround, what are those steps that they need to, but also how does the system work in juxtaposition to their day-to-day workflow. There is, over 50 job aids, and really making sure that there's quick sheets that are available so they don't have to go through all of those, but also more regular live training, more opportunities for them to learn and use the system while also training. So it's not just a recording, and then a more targeted agency by agency approach with not only our training team, but also the call center that supports case managers when they call in. I talked a little bit about the on-site visits, just really making sure that we're understanding on the day-to-day level in the community what they're experiencing and how those pain points are impacting their ability to perform their requirements, and working closely with them on action items that are specific to their agency and their agency's needs. And that has allowed the department to really understand how we should prioritize which known issues are out there so that we can stabilize and have the most immediate impact because we will be releasing those fixes every 2 weeks. So that started the 1st of April, and every 2 weeks we'll have a cycle of releases that will resolve all of the known issues. If we go to the next slide, talking about the appeal and escalations that have been coming into the department and making sure that we have the resources and capacity to address those timely, be responsive, and make sure they're holistically being resolved. Because oftentimes when they come in, it's not a singular issue. It's oftentimes kind of a multi-prong that requires a level of kind of a deeper dive and understanding what the root cause is. So we have identified and been able to recruit 5 additional staff. Interviews are being completed this week to be able to assist in processing grievances and complaints. We have also added 1 Spanish-speaking specialist to assist both with the escalations and appeals. The team has created a Spanish web form, or is creating it. It is in progress of converting as this existing escalation form into Spanish. And the team will be able to assist individuals in their preferred language. We'll continue to have email blasts once on a regular basis, but then once this web form is completed, we'll make sure to get it out. Our goal is to have it completed no later than July 1st. And then really trying to encourage folks to use this new web form and also the email address so that this team that we've pulled together can help triage and identify the right teams across the department to help resolve the escalation that it came in. So those links are here. We can drop them in the chat for you all so that we make sure that you have them. All right, and then Bonnie, I think I am turning it back over to you for some live Q&A.
Thanks, Amanda. I really appreciate it. And we are getting close to the end of our webinar, but I do want to take just a few moments to acknowledge the great questions that are coming in the chat and remind people that it is our intention to capture all of them and to use those questions to inform our future communications. There's just no way in the time that we have today for us to effectively be responsive to all the questions that you all have provided to us in the chat today. I do want to just highlight answers to things that we saw, sort of questions popped up repeatedly. One question was around, hey, do you all know about folks that have gaps in eligibility, and what are you doing about that? We actually have a singular person. So for people who were enrolled in LTSS, were terminated for whatever reason and are now re-enrolled, so we can see that they have a gap. We're going in and manually fixing that at a state level. So we have a process in place for that. It's roughly approximately 1,200 people out of our 83,000 plus that we can see that for whom that is an issue. We also have looked at the data in terms of people who were previously enrolled in long-term services and supports and for whatever reason haven't re-enrolled. So they're still showing as terminated. That's less than 1,000 people. And we have a team of people who have attempted to make contact several times and are going through and trying to do that again, making sure that those folks, I mean, maybe they've moved away. It's certainly possible that potentially they passed away, but want to make every attempt possible to make sure that people who want and need services have connection to those services. So that process is in place. And I know, Chris, you were going to jump on and maybe speak to at a high level some of the technical questions around the PARs and sort of direct people to the escalation process if needed.
Yeah, I wanted to just mention with our solutions, they are evolving and they are being implemented as every week we are getting more and more of our solutions implemented. And one of those is if you have a PAR or a service that is manually priced, we don't have that manual price on record right now without the PAR, so we will have that solution available in the near future. So if you're still getting some of those PAR denials because of manual pricing, that could be happening, and we plan to address that in the near future. So you can see that some of these claims pricings are still being evolved over time, and that, you know, some of the PAR edits will still deny when a PAR is on place if the procedure codes and modifiers are not appropriate for the right benefit. So we don't want to promise every claim will pay. There are still the billing rules in place for those procedures and those pricings. But as you run into problems, if you are still having an issue saying, I can't get this claim client, they're not showing eligible, or you're still having those technical billing issues, please use our complaint form. Send that up to us. Get us that information, and we'll be able to look at that in a little bit more detail to see if there's an eligibility issue, or there's a case management issue, or there's a billing issue. We can help address that through that. In addition, that we are backdating PARs and getting those approvals in. So we are being told by case managers they can't backdate PARs. We're working on that to make sure they understand how to get that in place and make sure those PARs exist. So we just want to let you know that more information will be coming out. We will be taking your Q&As from this webinar. We'll do our best to address some of the technical billing issues, but we'll have future communications on our way out. So thank you so much for attending today's webinar. Bonnie, did you have any final closing words?
Yes. Again, I just want to offer my sincere gratitude, especially to the providers on this call. We know that many of you have continued to render services while payment for services has been a challenge. And really that speaks to just your passion for this work. And we are deeply grateful that you have been working directly with us as we have worked to, I think, mitigate these challenges as quickly as possible. Please know that we are deeply grateful for you and are working really as feverishly as possible to make sure that that payment is rendered for the important services that you provide as quickly as possible. So I want you to hear that directly from our team, and know that you can anticipate future communications coming out. Again, our solutions are ongoing. We're hoping that, you know, as we're watching the claims payments go up, as the eligibility enrollments are going up, that you should be seeing some pretty significant changes in what your billing situation has been previously to what they should be now. But again, your questions are really helpful for us. They'll help us incorporate, we'll incorporate those into our strategies, into our communication, and really, again, deeply appreciate your partnership on this. And thank you for all that you do. And we'll be sending out, actually, there'll be a communication here shortly, probably today, potentially tomorrow, going out to the provider community. So anticipate more from us soon. And hope that you all have a wonderful day. And again, appreciate your time this morning.